contact lens is too tight, or you overwore your contact lens, or something, you did something in the front part of your eye that you temporarily made it unhappy.
Okay, and so for cataracts, there is some new surgery for it, right?
Well, right now, here's the cataract, which lies right here. Here's the front part of the eye, like the watch part of your eye, the clear glass, and this is the cataract, the lens. What people do now, surgeons do now, is take out this, and we put in a plastic implant right there. So when you, the surgery right now, there's two types of surgery that's very interesting. One, in developed countries in America or England or France, we make a very small incision, and then we use ultrasonic needle, which sucks it out, and then we put a foldable lens that fits right in there, a plastic lens. Now, what they've been finding is that in the third world or the developing world, such as India and Africa, you can do a 5-minute incision using no mechanization, and what they do is they take out this lens and they make a bigger incision, they put it in, and they suture it. And it's in these countries where they have no electricity or they have no resources to get the disposable lenses, the disposable kits, that this can be done for very little money, $6 per eye or $15 per eye. The only problem is that we know that this is being done in these nations, but we don't know what the follow-up is. We don't know if taking out the cataract in this really rough way has hurt the cornea, because we only heard of these reports. We haven't seen them in follow-up. And we don't know the risk of infection, because it's a kind of a rudimentary way of doing it, and we're a little more sophisticated in America in the sense that all our conditions are sterile. We have no risk of infection. It's like less than 2% the risk of infection. So it's an interesting time as we look at ways to save costs and, you know, change the ways that we do cataract surgery.
Okay, so for our home viewers who have cataracts, they should also see a retina specialist too, to make sure that the back of the eye is healthy, correct?
Yes. What happens is a lot of people go to a cataract surgeon and nobody really looks in the back of the eye, because number one, the cataract is so dense they cannot see the back of the eye. That's one. Or they think, oh, the retina's okay, we'll just take a little glance at it. But what happens is that they could be tiny little retinal holes here, and once they do the cataract, they get a retinal detachment, and then it's quite complex. Or many people get LASIK, and they don't look at the retina at all very carefully, or have a retina surgeon look at it, and they have retinal holes. And what happens is after LASIK, a year down the road or 2 years down, they get a big retinal detachment. And those people should be pre-treated with laser so that after LASIK they do very well. So those are things. So the retina is very important because it's the final stage of where the photon of light goes through. It goes through the front, through the lens, through the vitreous, and to the retina. It makes that final connection there, and there it goes to the brain, to the lateral genicular body, and then to the occipital lobe.
Okay, so I guess a lot of our home viewers are probably interested in LASIK too. So how does LASIK work?
Well, LASIK is very interesting in the sense that here's the cornea, the front part of the eye, and even though people aren't blind because they have 2200 vision, but with contact lenses they see 20/20, but they're sick of contact lenses, they're sick of wearing their glasses, they just want to open their eyes and see. So what happens is you take the cornea, you make a small incision that's only partial thickness of the cornea. So here's the cornea, it has a certain thickness, so you're making a partial, lifting the flap up, so part of it there's still cornea lift. You lift up the flap, laser it, flatten this curvature, put the flap back on, and then the whole cornea flattens out and you see better. You don't need the light, you don't need glasses. So what you're doing is that if you're nearsighted, instead of being a round eye like this, your eye is longer than usual, so it's like a long football. And this cornea has a certain curvature. So what you're doing is trying to focus that lens to a different spot. So you flatten this curvature, so you change the angle of refraction coming in here. So then you get this light photon to fall in the retina, and that's why they see better. But there are risks, obviously. 5% have haze and glare, so if they look at my face, they might be missing my ear at nighttime. But there happy with it because centrally they see the face, and they want the cosmetic look, and they are sick and tired of wearing glasses.
Okay, but not all LASIK people actually can stop wearing glasses. There are some that actually will still need glasses. Is that correct?
No, they usually stop wearing because what happens is that they change the curvature
Okay.
to the point where the glasses won't help them anymore because it becomes a very unusual astigmatism. But we now have new machines called femtosecond laser, which is decreasing that, the new wavefront LASIK. So be sure to ask about the new techniques, decrease the risks for that.
Okay, so I'd like to thank Dr. Gloria Wu for sharing with us her information about blindness and the new treatments available, such as Avastin and Lucentis. And thank you to our home viewers for watching us today.